Hi, it's Dr. Martha Lucas here with you today. I am a research psychologist and practitioner of Chinese medicine in Denver and Littleton, Colorado. In Littleton, I actually work in a Western medicine clinic. So that's a cool way for Chinese medicine to be integrated with Western medicine. Also, I treat mainly internal medicine. My specialty is the diagnosis, but I also teach. I teach Meisen cosmetic acupuncture and pulse diagnosis and a bunch of other stuff. So I'm pretty active in the Chinese medicine community. I want to thank the American Acupuncture Council today for hosting this webinar, the topic being fear and fertility. So let's go to the slides. Now, you'll notice I say fertility. I don't say infertility. I call it a fertility challenge, or you maybe have some issues with fertility because getting the diagnosis of infertility or being infertile is very damning for people. It's scary. It's like the doctor says you're infertile, so well, what am I even trying for? So I like to call it more like a fertility challenge. That way we know we're working on a goal that might actually be able to happen rather than saying you're infertile. So I'm going to get to the next slide. All right, so parenthood is one of the most desired and valued goals of adulthood. But as you know, many people have issues with that. Infertility, partly why we're talking about it, is because infertility turns out to be a great big diagnosis, very common. That's why we have so many fertility clinics, or I guess some call them infertility clinics. So it's a very much desired goal for women and men. Fear is an expectation of negative outcomes, right? And fear can be constructed from a very complex interplay of different relations, culture, psychological, social, physical. And one fear actually has a name. It's called fear of infertility. And it does impact us globally. It's not only something that's in the United States. And basically what fear of infertility is fear of inability to achieve pregnancy or father a child. Now, some fear of infertility is born out of misinformation. And as you can guess, there's a lot of misinformation out there. Years ago, a book came out called Everything You Need to Know When You're Pregnant. And I told my patients not to read it. I said, look, it's a natural process. You're pregnant. Just how about relaxing into it, letting it go? Because I had someone come in once, a pregnant young lady, and tell me she had been a nervous wreck up all night because she fell asleep on her left side, and she read in some book that if you sleep on your left side when you're pregnant, the fetus isn't going to get any blood flow. And I just said, whatever that is you're reading, stop reading it. It's a natural process. You're coming to see me. You're getting medical care. Everything is fine. Now, some of these misinformations include things like that the oral contraceptive pills stay in the womb and accumulate. Some of this stuff is very crazy sounding, but it is something that it is information that's out there. Some people believe birth control blocked their ability to get pregnant, or maybe even makes them infertile. There's the idea about the HPV vaccine, that it also is going to cause you to be infertile. And just the idea that if you use any kind of contraception, your womb is going to get what they call weak. So these fears can impact behavior, right? Like you might not do family planning anymore. You might be trying to just keep going for it. I had a patient who they were having intercourse every single day. And I said, oh my goodness, you need to stop that, number one, because the sperm and all your energies need to rebuild in between intercourses. So you need to stop that. Studies show that if you have intercourse once every 3 days, eventually you are going to hit, within a 3-month period, you're going to hit your the best time for you to actually conceive. And sure enough, after they stopped doing that, she was pregnant the next month. And again, some of these things, some of this misinformation makes women not go to the doctor or try some crazy stuff, rather than getting information that they know is true. Like this idea that the male is harmed if you have an IUD. Lots and lots of misinformation out there. Now, fears are constructed expectations of negative outcomes, like I said. And, the one of the ways that people get fearful is from this stuff like incorrect knowledge, like using birth control makes you infertile, or you can't get pregnant after you're 35. That's one of my favorites. And believe me, I've had plenty of women, and probably so have you, come and tell me, oh, well, I'm over 35 and I can't get pregnant. Distortions of the truth, like if you try for a year and you don't get pregnant, then you're not ever going to get pregnant. Well, that's for some people probably true, but not necessarily. Some women believe my periods have been so irregular in my life that I must be infertile. Again, that kind of stuff is just not true, and it's just false information. And they also get all kinds of interesting advice, like you just have to try harder. Well, it doesn't really work that way. And of course, there's the one that fertility challenges or infertility is a female problem. That is absolutely not true. 40% of the time, it's the male's issue. So this is why in my practice, I see both the man and the woman. I'm happy to see the woman and get her periods in order, but when we move up to my fertility protocol, I insist on seeing the male part of the conception team, because if his DMI is blocked, his reproductive organs are not getting the kind of care they should get. So I really do work hard on making sure that the male comes in. For one thing, they are more relaxed when they come in, because if they're suffering from fear of infertility and the wife or the woman, the female partner is also worried about it, then it's just, they're both lumped into this big worry thing. So what we need to do is also treat the man. I strongly recommend that when you're treating a couple, that's how I put it. I treat couples for fertility challenges because there can be the impact of the male. So, in traditional Chinese medicine, the kidney system is our powerhouse, right? The fire in the belly. It's one of our most important energetic systems. It's the root of pre-heaven Qi and post-heaven Qi, and kidney essence is a combination of those. So it's very important for growth and development and sexual maturation. After puberty, it more focuses on reproductive function and fertility. And as you know, as it declines with age, we get things like loss of teeth, hair loss, the symptoms of menopause. We do eventually are unable to conceive. And then, of course, we can have impairment of cognitive functions. Now, the importance for us as practitioners and using or understanding the relationship of fear and kidneys and fertility is that the kidneys fund all of the pulse positions. So if it's scattered, if it's not well formed and weak and scattered, then how is it going to support all the other systems? So if it looks like this, it's all little scattered points, then it's going to be hard to fund all the rest of the organ systems. In addition to regulating the body's fluids and growth, the kidneys also keep yin and yang in balance. This is why it's so important to make sure the kidney pulses are balanced, because as I just said, they fund all of the other organ systems and keep yin and yang balanced. It also governs body fluids, so tears, saliva, perspiration, and the fluids that lubricate all of our joints. It stores the life force, and it's associated with a healthy transition through life stages. So from childhood, early adulthood, all the way through the aging process, and then separating as we get closer to death. So it makes sense that if we need kidney energy to live, then it makes sense that we need to procreate. But that energy, kidney energy, can become lost and scattered as the result of this fear that men and women have about the possibility that they won't conceive. I know you see it more in women, and they're the ones who almost always make the phone call. However, I can just tell you from experience that when the male of the partnership is involved, everything is a little more calm. They understand the situation a little bit better instead of it all being a woman's problem, a woman's problem, a woman's problem. Now, we know that stress can negatively affect the ability to conceive. Well, so can this fear that people have that they're not going to be able to conceive and carry a healthy pregnancy through to birth can negatively affect fertility. We know that stress can cause irregular periods. It can cause lack of ovulation. Also, fear can negatively affect sperm quality and motility. So there again, we have about fear and stress and the fact that we also need to treat the male partner. And it can create hormonal imbalances. Stress can wreck the hormones, which also can have a negative effect on someone's ability to conceive. So besides the usual and customary pulse positions, we all know what they are. My system also includes on the left kidney side, the uterus and the prostate. So on the left kidney side is where you're looking for kidneys and uterus and prostate. So interestingly enough, it's on the left kidney side that where you're going to follow the pregnancy. In the beginning, it feels like a little blip, a little knot upward hitting your finger. But as the pregnancy goes on and that big ball of cells becomes bigger and bigger and bigger, that pulse position gets stronger. Now, what does a scattered kidney pulse feel like? Well, first of all, you feel the kidneys with deep pressure. So, a lot of pressure with your fingers down on the pulses, and you should be able to find the kidneys in there. But when there's fear in the system, the kidney pulse feels what I call diffused. So it's scattering under your fingers instead of feeling like a flow. That's what we eventually want to feel, right? We want to feel a flow like a river. This feels more like, I say, how fireworks start out strong, right? There's a boom, they go up in the air, and then they fall down in the air like this, little points of light. I like to say that that's how the kidney pulse feels when fear is involved. It feels like little points on your finger, little kind of like fragments of the pulse. So if that's scattered, there's no ability for it to move forward and fund the rest of the pulse positions. So this is the big problem with fear. We need to get the kidneys open and flowing in order to make the rest of the positions work correctly. Now, one of the things we need to remember is, that fear is it damages the source chi. It doesn't allow the kidneys to have a regular form. In other words, the sine wave, yang and yin, yang and yin, yang and yin. It doesn't allow it to have that, so it doesn't flow through the rest of the meridian systems. So here's a picture of it. As you can see, this is the left side, kidneys, gallbladder, liver, small intestine, heart. And those little dots, that's how the kidney pulse feels under your fingertips when you are feeling the pulse and the person has fear. Now, you might not say the words, do you have any fear in your life? Sometimes you need to just ask about stress or ask about the period, ask about their digestion, the things that are funded by the kidneys. And then you can move on to a more specific question like, well, do you have any fear? I have a case study of a woman who I felt this in her pulses. She was only 34 years old. No reason for her to be quote unquote infertile. But of course, the fertility clinic she was going to said, when do you want your IVF? And she said, well, I know an acupuncturist who helped her daughter, who happens to have lupus, get pregnant and have a successful pregnancy. So I'm going to do that first. Well, of course, they said, we'll see you in 3 months. We'll go over your blood work and your hormones again, and then we'll schedule your IVF. So, and she was determined. She said, I'm not going to do that. So I'm feeling her pulses and I can feel some fear. And again, from the outside, her life looked wonderful. She didn't have any problems. Both of them had really good jobs. They were happy for all intents and purposes. So I asked about her childhood. I said, well, how was your childhood? Oh, perfect, perfect, perfect. So then I said, and of course, as I said, I already knew her. I said, well, I'm asking because from your kidneys, it feels like maybe there's some old fear in there. And she said, oh, well, she grew up overseas. I grew up in the wartime in my country. Oh, so I said, oh, okay. So then I dove into that a little bit. Well, do you have any brothers or your father that were involved in the war? Did they get hurt? That sort of thing. And she said, no, I'm just, it was normal life, but there was a war going on. So when that sort of thing happens, then we need to move on to studying the kidneys a little bit more. So what is one big issue with this? Well, as I said earlier, there are a number of big issues with the kidney chi being scattered because all of the organ systems are funded by that. When I show my patients their pulses, I always show them that, these right here, these kidneys, this section right here is what is funding everything else. It's funding all of the other organ systems. So that's the real importance of the kidney chi being secure and having a flow, having a movement instead of just those little pieces of scatteredness. And you can see because the person probably has some anxiety along with their fear, the liver energy is using up the little bit of that scattered kidney and attacking the heart, small intestine, and making the person even more anxious and more fearful. So this is the importance of knowing how to feel a scattered kidney pulse so that you can consolidate it so it can work better for the other systems. So that's a perverse movement in the liver, right? We want all the organ systems to be nice, smooth sine waves. So that's probably, for me, the biggest issue is if the kidney chi is scattered, it cannot fund the rest of the positions. So all of the positions are going to suffer. And when you get a perverse movement, like here in the middle jiao, the problem with that is it's using whatever kidney energy is in there, trying to fund itself. So, as I said, the arrow at the top is where the liver is attacking the heart, small intestine. Now you'll notice it goes into kind of a block. Well, because our systems are all made to protect the spirit, right? We're not going to let any perverse energy into the spirit. That's what our body is always, always, always trying to do. So this is why we need to resolve issues like that in the liver, that frustration, because when the heart part is blocked, when the spirit part is blocked, not only does the person not feel any sadness, but they don't feel any joy either. So as you can see, the scattered kidney pulse can lead the other organ systems to get out of balance. So also remember, heart blood goes to the uterus, right? The heart manages blood. So if it's blocked, like in this picture, then it's not helping the uterus at all. So again, putting together all of the functions of all of the organs. Kidneys fund everything, so they need to be in order. If they aren't, then they're going to let the other organ systems get out of balance. So liver is attacking the heart, small intestine. It's unable to do the blood flow to the uterus. The patient is even more anxious and sad, and it's partly because their fear has scattered their kidney chi. And if you were to look at the right side, where it's kidneys, stomach, spleen, lung, large intestine, you would see perhaps a dip in the digestion, a dip in the earth's spleen stomach sector, because again, the kidney chi on that side is scattered and cannot fund digestion. Well, we know that that's involved in blood flow also. So if the person's digestion isn't working well, they're not only not making good quality chi, they're not making good quality blood either. And that's what we need for the uterus. We need a nice, warm, blood-filled organ in order to be able to conceive and carry through a pregnancy, a good, strong pregnancy. Because remember, the completely healthy childbirth, mother, child, everybody's healthy, it went perfectly, is still a small percentage. Almost always there's some sort of complication, preeclampsia, high blood pressure, something going on where that idea of a healthy live birth with everybody healthy and happy is still not the outcome that's 100% of the time. So this is why it's also important to see your patients during their pregnancy. I think lots of them, they come to see us, they get pregnant, and they think, okay, good, my treatment is over. Well, no, not really. For one thing, their dymi is probably blocked through the whole pregnancy. This means come in, let me open the dymi, let me get all that blood and oxygen flowing again, instead of being stuck because there's this big group of cells basically around the dymi. So it's keeping them healthy throughout their pregnancy, as well as just in the beginning when we help them get pregnant. So always remember, I tell my fertility patients, hey, Dr. Martha, I'm pregnant. Okay, but your treatment isn't over. So don't let things go to headaches every day, back pain every day, morning sickness every day. Don't let it go there before you come in and just get treated during your pregnancy. Keep everything open and flowing. Keep your digestion moving well. If you wake up tired in the morning, it's not because you're pregnant, it's because your digestion isn't working well. So realizing and remembering how important it is for all of the organ systems to work well, even during pregnancy, or especially during pregnancy, is another important thing. So what kind of treatment can you do for somebody who has fertility challenges that are related to fear? Well, as I said, you need to get the healthy kidney chi going. You need to get it bound together with the other organ systems. I say here, remember, a blocked dymi is going to prevent that. So even if you don't know how to feel a blocked dymi in the pulses, there's nothing wrong with just opening it up. You see a pregnant woman, you open up the dymi. Then you know that it's going to keep flowing through that area. In fact, a blocked dymi might be part of the problem affecting ovulation and menstruation, and in men, affecting men's ability to be a conception partner. So it's important to always remember about the dymi. And the Ren and the Chong, they help reinvigorate kidney chi, and also Chong helps with emotions and digestion, and the Ren Mai, of course, helps with any kind of fertility or menstruation issue. And even libido, like for example, some women get drier. They get symptoms of a drier vagina, and they say that they, of course, then lose their libido and really don't want to have intercourse. They want to because they want to get pregnant, but it doesn't feel very good. So knowing all of that and dealing with the ways that we can help that with acupuncture and herbs will help the person. I sometimes just do channel work also. I don't do particular points. I just want to make sure that the meridians are all flowing. So needling the channels, like kidney bladder, that is moist, get the kidney chi flowing, get it built up through the bladder. So it doesn't necessarily mean certain acupuncture points or that I have a specific scattered kidney chi formula, because of course everybody's pulses are different every time you see them, and it's important to deal with what's in front of you at the moment. And then, lifestyle advice for people. Well, we know the kidneys are traditionally sensitive to cold. So we would like the person maybe to put a hot water pack on their back just to help warm up the kidneys. Eat warm foods. Your water, drink it at room temperature instead of from the refrigerator. Some people say keep alcohol and things like coffee to a minimum. It depends on what their lifestyle is. Like if you're yin deficient, obviously you don't want to be drinking 3 pots of coffee a day. So it's also being aware of the patient's lifestyle. We know that a little salt is beneficial to the kidneys. It's why when you crave salt, we know that our kidneys are a little bit out of balance. The color is traditionally black or blue, so black or blue foods to strengthen and nourish the kidney. So things like eggplant, black sesame seeds. And then other foods that can nourish the kidneys include walnuts, figs, brown rice, and other whole grains. So asking your patients to change their lifestyle a bit is completely acceptable. So one of the ways you can help them is by giving them food ideas that are going to help the kidneys. And then of course there's always meditation, right? Or at home qigong. Try to control the emotions that are leading to the fear response in the kidneys. You can show them qigong circles on their belly to help their digestion, clockwise qigong little massage for themselves. Doesn't even have to be a hard massage. It can be barely touching the belly. And then meditation is just focus. Studies on meditation sometimes really don't even like to call it meditation. They just call it focus. So it's found that 5 minutes a day of focus. So focus on a bird singing, focus on a candle, focus on a chant. 5 minutes of that a day will change your brain to be more calm. It literally changes how your brain works when it's on fear or on anxiety. So things like that, having them have some sort of at-home tool to work with your treatments in helping them boost up their fertility chances. So with all that, I want to thank you very much for attending, and I want to again thank the American Acupuncture Council for sponsoring this. Next time, we're going to talk about worry and fertility, so I hope you will be able to tune in for that. So it's Dr. Martha Lucas. My website for teaching is lucasteachings.com, and my private practice one, which feel free to contact me, is acupuncturewoman.com.